हेलो स्टूडेंट्स, इस वीडियो में हम बात करेंगे अबाउट एस्ट्रोजन एंड एंटी एस्ट्रोजन. सो व्हाट इज एस्ट्रोजन? एस्ट्रोजन इज अ naturally occurring female sex hormone. Like androgen was naturally occurring male sex hormone, and estrogen is naturally occurring female sex hormone. Estrogen is produced by ovary, adrenal gland, and placenta. What is the mechanism of action of estrogen? As we know that all the steroidal hormones like androgen, estrogen, progesterone, and corticosteroid, etc., all bind to the specific receptor which is located in the nucleus. So like that, estrogen is also bind to its specific receptor which is located in the nucleus, and in nucleus receptor dimerization will occur, and it will interact with the estrogen response element, also known as ERE, that is estrogen response element, which help in the regulation of protein synthesis. Now about the receptors. Estrogen has two receptors. One is estrogen receptor alpha and another is estrogen receptor beta. Estrogen receptor alpha predominates in uterus, vagina, breast, bone, hypothalamus, and blood vessel. And another receptor is estrogen receptor beta. It is present in prostate gland of male and ovaries in female. Now what are the action of estrogen in a female body? It helps in the development of sex organ in females. For example, it helps in the growth of uterus, fallopian tubes, and vagina. Next, it helps in the proliferation of endometrium in the pre-ovulatory phase, and it also have the negative feedback control mainly on the anterior pituitary. Next, what estrogen do in a female body? It also augment, that is, it promote the rhythmic contraction of fallopian tubes and uterus. It also induces the watery alkaline secretion, which help in the sperm penetration. Near term, it also sensitizes the uterus to the oxytocin so that the contraction of uterus can occur and delivery can occur. Next, it also stimulates the development of secondary sex character in female, for example, proliferation of duct in breast and stroma in breast. Next is metabolic action of estrogen. It is anabolic in nature, means it maintains the positive nitrogen balance, and it also maintains the bone mass. How it maintains the bone mass? It retards the bone resorptions. Next, it also promotes the fusion of epiphysis. Next, it also promotes the positive calcium balance in the body. It helps in the increase of the high density lipoprotein and decrease the quantity of low density lipoprotein. It also causes the sodium water retention. Due to this effect, edema occur in the female body. It also enhance the coagulability, means it increase the concentration of the clotting factor, like clotting factor 2, 7, 9, 10, and it decreases the antithrombin clotting factor. Now we talk that it has also a negative feedback control on anterior pituitary. What does it mean? For example, we know that from hypothalamus gonadotropin releasing hormone is secreted, which act on the anterior pituitary and cause release of FSH and LH. FSH and LH have positive effect on ovary, and from Graafian follicle estrogen is released, and from corpus luteum progesterone is released. So when there is a high concentration of estrogen in body, then it causes the negative feedback on the anterior pituitary, so that there will be no enhanced stimulation of the FSH and LH, and then there will be decreased concentration of estrogen, whereas progesterone has both the negative feedback on anterior pituitary and hypothalamus. So next we will talk about estrogen. Estrogens are of natural type and synthetic type. Natural estrogen are estradiol, estrone, and estriol. Estradiol is the major estrogen present in the female body. Estrone and estriol are formed from the estradiol. Estradiol will be oxidized to form estrone, and then estrone is hydroxylated to form estriol. Estradiol is more potent. As these are natural estrogens, they are not effective orally because they have high first pass metabolism. They undergo the glucouronide and sulfate conjugation. These natural estrogens are excreted in urine and bile, and they also go the enterohepatic circulation. From if we give them orally, they first go to the intestine. There will in intestine they will undergo deconjugation and again reabsorbed in the enterohepatic circulation. As they are not effective orally and they have a shorter duration of action, then synthetic estrogens are produced. Synthetic estrogen are of two type again, like steroidal and non-steroidal. Steroidal estrogens are ethinyl estradiol, mestranol, and tibolone. And non-steroidal synthetic estrogens are diethylstilbestrol, hexastrol, and dinestrol. All these synthetic estrogens are effective orally and they have longer duration of action. So now we will talk about their uses, where these estrogens are used. Estrogens are used in the oral contraceptive, but they are used in combination with progesterone, that is progesterone. They will inhibit the luteinizing hormone, so there will be decreased ovulation and they will work as contraceptive agent. Next, in hormonal replacement therapy in postmenopausal women. The HRT is of like short-term estrogen therapy and long-term therapy. In short-term estrogen therapy, they help in the relief of the menopausal symptom. In menopause, there will be some menopausal symptoms like hot flushes, night sweats, depression, irritability, and sleeplessness. So for short-term therapy, estrogens helps in to relieving in these symptoms. Next, for the treatment of senile vaginitis, they are used in topical preparation. Dysmenorrhea. Next, they are used in girls where there is a delayed puberty. Next is they help in the treatment of carcinoma of prostate. Next, what are the side effects of the estrogens? They suppress, they lead to the suppression of libido, and there is increased risk of irregular bleeding and endometrial carcinoma because they cause the proliferation of endometrium. Next, they also causes migraine, epilepsy, and endometriosis. They didn't cause them, but they precipitate their effect. Next, estrogens are contraindicated in pregnancy because they sensitize the uterus to the oxytocin, and there will be a contraction of the uterus, and maybe the premature delivery and abortion can occur. As we talk about short-term therapy, there is long-term therapy in hormone replacement therapy. On long-term basis, estrogen will prevent or delay the osteoporosis as they maintain the bone mass by retarding the bone resorption. Next is antiestrogen and selective estrogen receptor modulator, also known as SERMs, SERMs. So first we will talk about antiestrogen. Antiestrogens are like pure estrogen antagonist and some are aromatase enzyme inhibitors. Pure estrogen antagonist means these agents will competitively block the estrogen receptor, and they will cause and they inhibit the negative feedback mechanism of estrogen. So when there will be negative feedback means there will be increased FSH and increased LH, means they are inhibiting. So next we will talk about antiestrogen and selective estrogen receptor modulator, that is SCRM SERMs. First we will talk about antiestrogen. Antiestrogen is like pure estrogen antagonist and aromatase enzyme inhibitors. Pure estrogen antagonist means these agents will block the estrogen receptor. They competitively block the estrogen receptor. So what will be the effect? They will inhibit the negative feedback. As we discussed that the estrogen has negative feedback mechanism, so there will be no ovulation. So these estrogen antagonists will inhibit this negative feedback, so there will be increase in FSH and increase in LH, and there will be ovulation. So the agents which are pure estrogen antagonists are like clomiphene citrate and fulvestrant. Fulvestrant is also known as selective estrogen receptor downregulator. Clomiphene citrate is given orally and fulvestrant is given intramuscularly. So what are the uses of clomiphene citrate? Clomiphene citrate is used to treat the male and female infertility. In male, they will promote the spermatogenesis and testosterone secretion in male, and in female they are used in the treatment of infertility caused by unovulation. As we know that they will help in the increase of FSH and LH and cause ovulation, so these are used for the female infertility. Next, they are also used in the assisted reproduction therapy and in vitro fertilization. As we know that estrogen helps in ovulation, so the assisted ovulation can be occur with the help of this clomiphene citrate. Clomiphene citrate is given in cyclic therapy. It is not given in continuous therapy, and more than 6 cycles are not given of clomiphene citrates. So what are the adverse effects of clomiphene citrate? Like, as it causes ovulation, so there will be chances of polycystic ovaries, and multiple pregnancy can occur because ovulation, when the ovum are more produced, then chances of multiple pregnancy is there. Hot flashes, gastric upset, and also ovarian hyperstimulation syndrome can occur. They also increase in the risk of ovarian tumor because they causes the proliferation of ovum and endometrium, etc. Next is fulvestrant. Its mechanism of action is, as we discussed, these androgen receptor binds to the nucleus and there will be androgen receptor dimerization. So it inhibits this estrogen receptor dimerization. Fulvestrant is used in the treatment of breast carcinoma where these sums cannot be used. Now we will talk about aromatase inhibitors. Aromatase inhibitors drugs are like non-steroidal type and steroidal type. Steroidal type is also known as type 1 and non-steroidal is also known as type 2. The non-steroidal aromatase inhibitors are letrozole and anastrozole. Mechanism of action of these aromatase inhibitors are like estradiol is also produced from the testosterone by action of the aromatase enzyme. So these will inhibit this aromatase enzyme, then and there will be no formation of the estradiol. They reversibly inhibit the aromatization of a ring of testosterone. So when there will be no estradiol, so again they inhibit the negative feedback and there will be increased in FSH and LH. The steroidal type is exemestane. This will inhibit irreversibly. These inhibit the enzyme reversibly, but exemestane inhibit the enzyme irreversibly. So what are the side effects of these aromatase inhibitors are like hot flashes, vaginal dryness, nausea, diarrhea and dyspepsia. And these are used in the treatment of early breast carcinoma and advanced breast carcinoma. And these are contraindicated in premenopausal women. Next, we will talk about estrogen receptor modulator and sums. These sums are partial agonists and their effect depend on the tissue on which they are acting. They also act as agonist and antagonist. The drugs in SCRM sums are tamoxifen, raloxifene and ormeloxifene. So first we will talk about tamoxifen. Tamoxifen has both antiestrogenic action and estrogenic action. Means they have tissue specific action. In some tissue they will act as agonist and some tissue they will act as antiestrogenic. The effect tamoxifen antiestrogenic effects produced on breast cancer cell and peripheral sites. So when they will act on breast cancer cell, so means they will help in the treatment of the breast carcinoma because they reduces the tumor size. And peripheral site on they have antiestrogenic action and antiestrogenic action, so they will cause the hot flashes. The estrogenic action they produce on endometrium, so they will cause proliferation because we know that estrogen causes the proliferation of endometrium. On bone they decrease the risk of osteoporosis. And in plasma lipid we discussed earlier that estrogenic actions are increase in HDL and decrease in LDL. Next we will talk about raloxifene. Raloxifene also shows the antiestrogenic action and estrogenic action. Raloxifene has antiestrogenic action on breast and on endometrium. They don't show antiestrogenic effect on peripheral sites. So on breast, so they will cause anti-proliferation effect on tumor, so they will decrease the tumor size and they decrease the endometrial proliferations. So these can be used. So raloxifene can be used in the treatment of endometriosis, but tamoxifen cannot be used in the treatment of endometriosis because it causes the proliferation, and raloxifene causes inhibit the endometrial proliferation. Next, estrogenic action of raloxifene on bone, same as tamoxifen, so they have anti-resorptive effect. Next, on plasma lipid, they decrease the LDL and cholesterol, but they have estrogenic action on blood. As we discussed earlier that estrogen produces the enhance the activity of coagulation factor like 2, 7, 9 and 10, so there will be increased risk of venous thrombosis. Ormeloxifene has antagonistic action on breast and uterus, so ormeloxifene is used in the treatment of dysfunctional uterine bleeding. So in this video we will discuss about estrogen, anti-estrogen, selective estrogen receptor modulator. Hope everything is clear to you. If you like this video, please do share and subscribe. Thank you.